There is a reason meningococcal disease frightens doctors and families alike. It does not always arrive with drama in the beginning. Sometimes it starts like a simple fever, a headache, a little body pain, the kind of discomfort most people brush aside and promise to watch later. But later can come fast. And that is the part too many people never see coming. The most dangerous thing about meningococcal disease is not only how severe it can become, but how easy it is to underestimate in the earliest hours. A shared drink at school, a crowded dorm room, a long, tiring week with too little sleep. A child, a teenager, a loved one saying they do not feel right, and everyone hoping it is nothing serious. But what if the small signs are the moment that matters most? What if prevention does not begin in the hospital, but in the quiet choices people make every day without even thinking about them? In today's video, we are going to uncover how to prevent meningococcal disease effectively with calm, practical, and realistic steps that can help protect you and the people closest to you. We will talk about how this infection can spread, why certain groups may face higher risk, which daily habits can quietly lower that risk, and why awareness itself can become one of the strongest forms of protection. This is not a video meant to create panic. It is a video meant to replace uncertainty with clarity. Because when something can move quickly, being prepared is not fear, it is wisdom. And by the end of this video, you will have a clearer understanding of what truly matters, what common mistakes to avoid, and what small actions may help make a very real difference before danger ever has the chance to grow. Now let's move into the heart of prevention, because this is where many people make a critical mistake. They think meningococcal disease is something rare and distant, something that happens to other families in other places under unusual circumstances. But one of the most important truths to understand is that meningococcal disease can begin with symptoms that look ordinary at first, and it can worsen very quickly. It is caused by bacteria spread through close or lengthy contact, especially through respiratory and throat secretions, which means the risk rises in everyday situations people often consider harmless. Living closely with others, sharing personal items, staying in crowded indoor spaces, or spending time in group settings like schools, dormitories, military housing, or large gatherings. That is why effective prevention does not begin with panic. It begins with awareness. When people understand how the disease spreads, they stop treating prevention like a medical mystery and start seeing it as a series of smart, calm decisions made before a crisis ever begins. The first and strongest layer of protection is staying informed about recommended meningococcal vaccination. According to the CDC, meningococcal vaccines are the best way to protect against meningococcal disease, and they are recommended for all preteens and teens as well as for children and adults at increased risk. This matters because many families do not think about meningococcal vaccination until a school form, a college requirement, or a health scare suddenly brings it up. But prevention works best when it is proactive, not rushed. A parent preparing a teenager for student life, a grandparent helping care for children, or an adult planning travel or entering a high-risk setting can benefit from asking a healthcare professional whether they are up to date and whether additional protection is recommended for their age or situation. The goal here is not to overwhelm the viewer with vaccine schedules. The goal is to remind them that prevention becomes much stronger when they ask the question early instead of after exposure has already happened. The second prevention habit sounds simple, but it is often ignored because it feels too ordinary to matter. Do not share items that carry saliva. Share drinks, water bottles, straws, utensils, lip balm, toothbrushes, even the quick casual bite of someone else's food. These tiny habits can seem harmless in a relaxed social moment, especially among family members, teens, or close friends. But when bacteria spread through respiratory and throat secretions, these little exchanges stop being trivial. They become avoidable exposure. This is especially important in homes with children and teenagers, during sleepovers, at school, on trips, or whenever people are tired, distracted, and less careful than usual. Many people think prevention has to be dramatic to be effective. In reality, some of the best protection comes from small boundaries that become part of normal daily life. Keep your own bottle. Use your own utensils. Replace shared habits with safer ones. These are not fearful behaviors. They are quietly protective ones. The third step is one that supports the whole household. hand hygiene, and respiratory etiquette. Washing hands regularly, especially after coughing, sneezing, blowing the nose, or caring for someone who is unwell, is one of those habits people know they should do but often underestimate. Covering coughs and sneezes, discarding tissues properly, and keeping commonly touched surfaces clean may sound basic, yet basic habits are often the ones that shape real-world prevention. In a busy family, it is easy to let standards slip when everyone is rushing out the door, eating in the car, coming home tired, or dealing with children who touch everything and remember nothing. But daily protection is built in these very moments. The person who wipes down shared surfaces, encourages hand washing before meals, and keeps sick family members from close unnecessary contact is doing more than being careful. They are reducing the chances of spread in the most practical way possible. The fourth point is one that often gets overlooked in health conversations because it is less dramatic than medicine and less visible than symptoms. The body handles illness better when it is supported by better sleep, balanced nutrition, and sensible recovery. This does not mean a healthy lifestyle can replace medical prevention. It cannot, but it does mean the daily foundation matters. Sleep deprivation, chronic stress, poor hydration, and weak daily routines can leave people run down, especially teenagers, caregivers, and older adults who may already be pushing through fatigue. A household that eats reasonably well, rests when sick, stays hydrated, and respects the need for recovery creates a stronger environment for resilience. This is especially valuable for viewers in middle age and beyond, because many already understand that health is rarely shaped by one single event. It is shaped by repeated choices. Prevention, in that sense, is not only about one doctor's visit or one reminder. It is also about building a daily life that is less chaotic, less depleted, and more protective overall. The fifth and perhaps most urgent prevention lesson is this: learn the warning signs and do not delay medical attention if symptoms appear. Official guidance warns that meningococcal disease can start like a flu-like illness and then rapidly worsen, and both meningitis and bloodstream infection can become deadly in a matter of hours. This is why awareness itself can save lives. Fever, severe headache, stiff neck, nausea or vomiting, sensitivity to light, confusion, extreme sleepiness, cold hands and feet, muscle pain, and an unusual rash can all be warning signs depending on how the illness presents. The frightening part is that not every symptom appears at once, and a rash may not appear early or at all. That is why families should never rely on one sign alone to decide whether something is serious. If someone seems suddenly very ill, deteriorates fast, or has symptoms that feel far beyond a normal cold or flu, immediate medical help matters. Waiting to see how it looks tomorrow can be a dangerous gamble. Prevention is not only about stopping infection before it starts, it is also about responding fast when the body begins sending distress signals. Another often missed area of prevention is knowing who may face higher risk.
Tudo julgado
CDC
por uma
notes that
comissão
anyone can get
formada.
meningococcal
Tudo julgado por
disease,
uma
but
comissão
some groups are
formada.
at increased
Tudo
risk, including certain age groups and people in particular living or health situations. That means prevention should become more intentional during key life transitions. When a child enters adolescence, when a teen prepares for college housing, when someone joins the military, when a person has certain medical conditions, or when travel or community outbreaks change the local risk picture. Instead of assuming one general level of risk for everyone, families should think in seasons. What stage of life are we entering? What environment are we moving into? Are we about to spend more time in crowded settings? Are vaccinations current? Has a healthcare provider ever mentioned higher risk status? These questions shift prevention from vague concern to practical readiness. One more critical point deserves attention. If there has been close exposure to someone diagnosed with meningococcal disease, that is not the moment for home guessing or internet rumors. WHO notes that antibiotics may be given to close contacts to reduce the risk of transmission. In real life, this means families should follow public health and medical guidance quickly if they are told they have had significant exposure. Do not self-medicate. Do not assume, "I feel fine, so I must be safe." And do not delay contacting a healthcare professional if public health officials or clinicians advise follow-up. This is one of those moments where speed, clarity, and good communication matter far more than fear. So when we ask how to prevent meningococcal disease effectively, the answer is not one single trick. It is a layered approach. Understand how it spreads, reduce avoidable close contact exposure, avoid sharing saliva-contaminated items,
Tudo
support
julgado por
hygiene
uma
at home,
comissão formada.
stay
Tudo
aware of
julgado por uma
vaccination
comissão
recommendations,
formada. Tudo
recognize
julgado por
high-risk situations, and take symptoms seriously the moment they seem to escalate. That is what real prevention looks like. It is steady, informed, and deeply practical. And perhaps most importantly, it gives people something powerful in a situation that can otherwise feel frightening. A sense that there are meaningful steps they can take today in ordinary life to better protect the people they love. Before we go any further, pause for one honest second and ask yourself this. If someone you love came home tonight with a fever, a headache, and the kind of exhaustion that seems ordinary at first, would you know when it is safe to rest and when it is time to act fast? That question is uncomfortable, but it matters. Because one of the biggest mistakes people make with meningococcal disease is assuming the danger will always look dramatic in the beginning. Sometimes it does not. Sometimes it whispers before it roars. And that is exactly why prevention is not just about what you do when fear arrives. It is about what you remember before panic has the chance to take over. So here's the part many people overlook. The most powerful protection often begins in quiet habits, quiet awareness, and quiet preparation. A simple choice not to share a bottle, a simple decision to stay informed about recommended vaccines, a simple willingness to take unusual symptoms seriously instead of brushing them aside. These may not look like heroic moments, but in real life, they are often the moments that matter most. And when you bring all of this together, the message becomes very clear. Effective prevention starts with understanding how meningococcal disease can spread, continues with practical habits that reduce unnecessary exposure, and becomes even stronger when families stay alert to early warning signs and act without delay when something feels seriously wrong. If you remember only a few things from this video, remember these. Protect the everyday habits inside your home. Stay
tudo
proactive instead
julgado
of
por uma
reactive.
comissão
And
formada.
never ignore
Tudo
symptoms that
julgado por uma
escalate
comissão
quickly or feel
formada.
far
Tudo
beyond a normal
julgado por uma
illness.
comissão.
Sometimes the difference between danger and protection is not luck. Sometimes it is simply awareness, one decision earlier. If this message gave you something valuable today, save this video so you can come back to it when you need it most, and share it with someone in your family who should hear it too. And if there is another health topic that has been quietly worrying you, leave it in the comments, because the more we understand together, the better we can protect the people we love.